This recording will be on the NEHA YouTube channel. The previous town halls that we had are on there as well. So I'm not sure if you've had a chance to listen to any of those, or you're just coming in from where you're at taking an exam or thinking about taking an exam. But to start it off, my name is Sarah Hoover. I'm the credentialing manager for NEHA. And then also on the call with us, we have Carol Newland. She's the REHS credentialing specialist. Eileen Neeson, who is a credentialing specialist, not the REHS, but other credentials. So she's very knowledgeable as well. And then Charles Powell is our IT manager. He's going to help if there's any IT issues to troubleshoot. He's getting the recording started. But those are the NEHA staff that's on the line. And so I see that there are 3 that I don't recognize, and I don't mean to put everybody on the spot, but it might be a good idea if we just, since we have a small group, if you guys don't mind, just kind of go around and introduce yourself. So Lizzie, do you mind kicking off?
Sure. I'm Lizzie Rhodes. I work for the Douglas County Health Department in Omaha, Nebraska, and I'm the president of the Nebraska Environmental Health Association here. So I want to kind of pass on all the updates to our members.
Okay, that's fabulous. And if you want to remain on mute, if it's not possible to talk, that's fine. If you want to use the chat, you're welcome to use the chat. It is, like I said, it is an informal group, so I'm just going to spend this time kind of running through some of the FAQs and some of the different aspects of this upcoming exam. And as people have questions, just jump in and ask them or raise your hand. But let's see, we also have Sarah Hughes, if you're able to introduce yourself.
Hi, my name is Sarah Hughes. I'm interested in taking the REHS in the near future, so I'm just trying to acquire more information about it so that I can adequately prepare for that.
Excellent.
Thank you.
Welcome. And then there's someone on the phone. Do you mind, a 774 area code? Do you mind introducing yourself? I think it's *6 to mute and unmute. Sometimes the phones are trickier than the laptops. Okay. Well, we'll just get started. Thank you all for joining. I think it's great that you're here, and it is nice that we have a kind of an intimate group so we can just take questions as they come and go along. So I think that's really nice. Hope I'm not making you dizzy because I was putting all my screens up and down. But I think we'll just start, and I will open up on our website where we have information about this credential. And unless you have specific questions, I'll just kind of run through the FAQs. And those are, what we thought of ahead of time to say, maybe these are the things that people would be most interested in knowing. So if there's things beyond the FAQs, we'll talk about those, but I am going to share my screen, and then we'll kind of run through that information. So right now, does everyone see the REHSRS credential page? And that should be the only thing up. Are you? Yeah.
Yes.
Okay.
Yes.
Sorry, I'm not looking at the I'm not looking at the Teams window. Okay, so here's the main, this is where we put most of the information. So as new information comes in, we post it here. This would be a good website to just tag if you haven't already visited it, keep it. Well, if there's anything to update or add, we will put it here first, and then other means of communication. But so if you're all aware, the go live date of this new exam is going to be September 1st, 2021. So what that means is that up until September 1st, the current version of the exam is going to be used. So anyone that takes the exam at Pearson VUE, they will see the current exam that we have through August 31st. And then that very next day, the questions and answers are going to change. It'll be a new exam form. And so that is a hard date, a hard deadline. So I want everyone to be aware of that first of all. Here we did come up with some FAQs, and I'll magnify my screen a little bit to help you see it. But let's go out a little bit. Okay. So first of all, people may ask, why is the exam changing? You know, it could be like, well, it's fine, it's great. Why are you changing it? And the reason that we're doing that is because it's just periodic maintenance. So a credential exam kind of has a life cycle. It becomes created, and then periodically, it's the questions and answers are looked at. We try to do that every year if we can, and then every about 5 years we look at the blueprint. So not only the questions and answers, but the blueprint or the backbone that crafts what those questions and answers end up being. And so that's what we did. The last time that this exam had a significant blueprint revalidation is what they call it, but the last time that this happened was in 2013. So it is time to do this again. And so that's what we're doing. This isn't, it's not a one-off, it's not a special case, just to kind of set everyone's mind at ease. This is a normal part of an exam, the life cycle. So as I said, the new exam is going to be available on September 1st. And here, this is an important piece right here, this crosswalk that we created. Again, it's kind of to allay any fears that someone might have or concerns about the differences of the information. So if you notice, this is the current exam is the first column. And these are the buckets in the blueprint that you might be familiar with: conducting facility inspections, conducting system inspections, conducting investigations, ensuring compliance, promoting environmental public health awareness, and responding to emergencies. So those are the broad categories right now on the blueprint. And those are the percentages that they comprise the entire exam. So then on the right is what the exam will be as of September 1st. So if you notice, there isn't a whole bunch of change. It's kind of more a recategorization of some of the percentages. So, and so now it's just conducting inspections. That includes facility inspections. It includes systems inspections. It includes other places that might need to be inspected, and that is broken down on the blueprint a little bit farther in detail, and we'll go over the blueprint as well. But conducting inspections kind of runs the gamut then, and it went from 55% to 48%. So if that, just to kind of give you an idea of how that overall change is going to be. Then conducting investigations. In the new exam, there's going to be a few more questions that cover investigations. It's going up from 12% to 18%. Ensuring compliance and conducting compliance review. The name changed, but the overall measure of what they're testing, the content is the same or very, very similar. So that's going up a couple percentage points. Promoting environmental public health awareness and performing environmental health surveillance. Again, those categories just went down just a little bit from 13 to 12, and then responding to emergencies and promoting environmental health information, those stayed the same. So the name might change, but again, the content of what's being tested is the same. So that's why we've made this crosswalk. I will stop, and if anyone has any questions right now, you can ask. I'll look in the chat. If not, I'll keep going, but I just wanted to make sure that we're all good on that.
Sarah, it looks like Sharon Unkart has joined us.
Oh, great.
So I just wanted you to be aware of that.
Thank you. Hi, Sharon. I'm just I'm sharing my screen, and we have a few with us. Sarah is interested in taking the exam soon, and Lizzie is with is it Missouri? No.
Nebraska.
NEHA. And so she's getting information to take back to her local chapter.
All right, sounds good.
And we have somebody on the phone.
Yeah, we have somebody on the phone. So we're running through the FAQs right now. And it's very informal. Just pop up if you have anything to add or questions. So we've gone through this, the changes, how, they're not that drastic, the change, the overall exam content should be very similar from August 31st to September 1st. So here's another question that we thought might be in people's minds is, what's the passing score? Right now, we have the passing score of 650, and that is going to stay the same. I'm actually wrapping up the meeting for that. We have to do a workshop where the 650 score gets calibrated by subject matter experts. And so we are doing that, and it will be set to 650. So the score is going to be the same to pass. Now, we are going to reduce the number of questions a little bit. The total number of questions now will be 225. Right now there's 250. But this does not mean that the new exam is going to be easier. It's going to be just as hard, or just as rigorous. I don't want to use the word hard. It's going to be just as rigorous to pass as the current exam. So because it's going to be calibrated, and because the questions and answers are going to be looked at and set to a 650 passing score, that means that it will be, in terms of how hard or easy to pass, that will be negligible. So it really doesn't matter which exam you take if you wait until September or if you take it in August. It's not like one exam is going to be easier or one group will be easier to pass. Okay. And as far as the questions right now on the exam, there are pilot questions, and this is true of the new exam. So I don't know if anyone's aware of that, but with any exam form that's out there, there are some questions, they're a small percentage, it's not a large percentage, but there are a few questions on the exam that are actually pilot status. So answering those doesn't count towards your score in any way, but they are used because there's statistical analysis done on those to make sure that they are performing well. Is it a good question or is it a bad question? And statistical analysis help tell us, should we keep that question? And if it ends up being a good question, then we rotate it into a scored status. Okay. So as far as which exam, if you're curious about which exam you should take, we are not going to advise you on a specific action. So it really boils down to personal choice and what your circumstance is. We are just hoping to provide as much information to you as we can so that you can make the best informed choice for your situation. Some individuals may have deadlines by their employers, and so that's easy enough. That means they have to take it by a certain time. But if someone is kind of on the fence, I am happy to follow up individually with people. But really, it just kind of depends upon everyone's personal circumstance. And so what we're doing is we're telling individuals, and we're being very upfront about, okay, the exam is going to change on this date. It is a hard date, and this is the new blueprint. This was the former blueprint. And so hopefully that will help them determine what's the best course of action for them. So when it does get tricky is when it comes to retakes. I'm on FAQ number 7. And so we've thought about retakes because this is there will be hopefully a small percentage of the population, but they will be affected. So if someone does need to retake their exam, theoretically, someone could take an exam in August, like let's say mid-August, and they might have to take the new version of the exam in September, just because it takes a few weeks to turn around a retake application. And it might take a little bit of time to get a chair appointment at Pearson VUE. So we're just hoping to, like I said, be as transparent as possible and tell people ahead of time, so that maybe if someone was planning to take an exam in August, maybe they push that up to like July or June, and then have a little bit more time to see if they would need to retake it, and they could take the existing exam if that's something they wanted to do. But again, back to that blueprint, if you're preparing for this exam now, if you're preparing for the current version of the exam, you should be set up pretty well to take the new exam in September 1st. And to kind of alleviate this, normally we do ask that people wait 90 days before they retest. And we still, if it's possible, we still will recommend the 90-day waiting period. And that is because we have been shown statistically that people that wait 90 days, they tend to actually perform better than someone that might want to take a test again the week later. A lot of times people are very, I don't know, a little nervous, I think, and it's not good to have to retake exam, of course, but sometimes they want to just jump at it and get it done. And while we certainly understand that, it actually statistically shows that people perform better if they can take a few months to brush up on their studying and come at it again a second time. So that's why we recommend the 90-day window. However, because of thinking about the timing of this, we are waiving that. So if someone does need to retake, it's okay if they retake within the 90-day window. We're going to waive that. However, like I said, it's recommended. So if it's possible, we will let the individual know, you can do this. You can take your exam within 90 days, but we actually recommend you wait if at all possible. Okay. The cost of the exam is going to be the same. We're not increasing the cost. And Sharon is on the phone if anyone has specific questions about the study material, but the new study guide or an updated study guide, I don't want to say it's Sharon, is it right to say updated or brand new? But it's anticipated to be released in June 2021.
It'll be a new edition, so it'll be a fifth edition.
Okay, 5th edition. But if you recall, going back to this this crosswalk here, the 4th edition is still going to pretty much cover what's coming out. So, certainly I'm sure it would be nice to have the 5th edition, but if that's not possible and you really want to take the exam, early September or something like that, you're not going to be completely unequipped to pass or, to study with the exam, with the existing guide that we have right now. Okay. And so if anyone has questions about the return policy for the study guides, there are within 30 days of purchase, returns are accepted. And Trisha Bramwell is the person to contact for those returns. And her email is here. Again, if anyone, I'm going straight from the NEHA REHS credential page website. So if you want to revisit any of these FAQs again, I highly recommend just go to this credential page, and all of this information is here. And if you forget the link, you can Google NEHA REHS and it'll pop right up too, if you're just doing a general Google search. Okay. So if there aren't any questions, I will bring up the new blueprint. Like I said, all of this is here. So that's nice that all of the links are here. This is kind of a one-stop shop for this. Ooh, that's heavy. Okay. So now we're looking at this blueprint. This is going to be the one that's in place September 1st. Okay. So this goes into a little bit more details when we're talking about, and it, I do apologize that it's not in descending order. So, but when I was talking about the inspections, the facility inspections and the system inspections from the old blueprint, this is how it translates to the new blueprint. So if you see what falls under inspections, there's institution inspections, healthy homes, group gathering, body art, recreational water, potable water, wastewater, food. Food is a major one, and it still remains. But to give you an idea, this is a little bit more in depth as to what those inspections would entail. And then if to understand the blueprint, there's the number of items. So this is the number of items on the exam that respond to the overall category. And then underneath, then the number of items that fall under each particular category. So you see body art, there's 2 questions on body art. There are individuals that do need to go and look at those facilities, but if you are someone and you have a really good handle on, let's say, the food inspections and the water inspections, it, it'll be okay if you might not know as much about body art. Okay, so that's how this is intended to guide you, is to look at the breakout and just say, well, how knowledgeable am I? And am I really, really good on regs and standards? Or that's 11 questions. So if you're not, then that's something that you would want to address. Conducting investigations, conducting compliance review, HACCP plans, providing environmental health information. That's where your emergency response comes in. And then I'm going to go back, because this is kind of a smaller percentage, but back to performing environmental health surveillance. So that's the blueprint. And again, this is available on our website. This is available to anyone that wants to see it at any time. So I highly recommend that as questions come up, feel free to visit that document and the FAQs. And beyond that, I'm happy to answer other things that might not have been covered on those. Yes, Eileen, you're muted.
Sorry about that. I wanted
no
to point out that if you are taking the current exam or curious about the current exam, that blueprint is also on the website.
Yes.
So you compare the two, they're slightly different, but you can see what the current one is as well, down to that granular detail. And people always say, what are the questions? And it's like, we can't tell you that, but at least you'll know the categories.
Right.
And how many questions in each category.
Yes.
Yeah, and I would just emphasize that everything that we can release about the exam is posted on the website. So sometimes people call me and try and pick my brain about what's going to be covered, and it's all there on the website, and there's nothing more that we can release. In fact, we don't know a lot of it in detail. I work with people that are applying for the credential exam, and I don't know what the questions are. I just help people apply, and then I help them when they get their score. But everything that we can put out there is on the website. It's pretty extensive, but of course we're not going to list the questions, but
yes. And also, when the study guides are being designed, they are not like Sharon's group. They don't know what the questions and answers are either. And that's by design, because we are not teaching to pass a test. We're teaching you to have professional competency, or to make sure that you have professional competency. So that's a huge distinction. We get that question sometimes frequently. And just to make sure that that's very clear, there is a lot of effort goes into making sure that those two places don't intersect, so that the people that are instructing or that are writing the chapters or doing the study guides, they don't know what the questions are either. They have the blueprint, and that helps them. But as far as the actual questions and answers, it's by design that they don't see them. It actually makes for a really strong test.
I might have missed it. How many pilot questions did you say there would be?
25.
Oh, okay.
Yeah, so it's just kind of in here. Actually, I will lower this. So on the website, I have it. The current exam has 225 scored and 25 unscored. So the new exam will have 200 scored and 25 unscored. And that just helps us, like I said, over time. Eventually, those unscored questions become scored questions as scored questions are cycled out. That has to do with like the lifetime of an item bank. If that term is familiar with anyone, all of the questions and answers for an exam are referred to as the item bank.
Okay.
Yep. And my email, I believe, if I haven't talked to all of you, but my email is here. It's shoover@neha.org. And, happy to talk to anyone. we are going to have another town hall this afternoon. It's going to be just like this. So if you attended this morning, you don't need to attend the afternoon, but we are going to have another afternoon session. And primarily it's just, like I said, to help people. This is, it's a change. And so we just want to make sure that we can, like I said, equip people and give them as many tools as we can so that they can make the choice about, when they want to test and whatnot. Okay. Well, we're almost to, we allowed 30 minutes for this. It seemed in our February town halls, we had them a little bit longer, and it seemed like 30 minutes was the good spot. So unless anyone has further questions, we all adjourn. Happy to answer anything though. No? Okay. Well, I hope everyone, if you're on the East Coast, have a good afternoon. If you're on the West Coast, have a good morning. All right. Thanks for joining. Okay. Bye.
Bye.